Hello everyone, my name is Katie Brennan. I'll be presenting an educational module discussing the use of dexmedetomidine to reduce postoperative delirium in the elderly population. The learning goals are as listed below: defining postoperative delirium and its consequences, reviewing the medication dexmedetomidine and its effects on postoperative delirium, and discussing findings from a literature review about the effects that dexmedetomidine has on postoperative delirium. Postoperative delirium is an acute state of confusion where the symptoms come and go. Patients experience altered focus and attention, memory loss, disorientation, and language and perceptual disturbances. It typically develops 24 hours postoperatively and lasts 48 hours on average. Postoperative delirium occurs in 20% of hospitalized patients over 65 years old, so this is a significant issue in geriatric patients undergoing surgery. Postoperative delirium is associated with higher mortality, functional and cognitive impairment, admission to long-term care facilities, longer hospitalization, and higher costs. Dexmedetomidine is a selective alpha-2 agonist that inhibits noradrenergic firing in the locus coeruleus, which causes sedation. Dexmedetomidine is an excellent medication that can be utilized as part of an anesthetic. It is not only used for sedation and anxiolysis, but it also has analgesic properties, which can reduce intraoperative opioid consumption. In addition, it preserves respiratory function, which makes it valuable for managing difficult airways and procedural sedation. When administered rapidly or as a loading dose, dexmedetomidine also activates peripheral alpha-2 receptors in the vasculature, which causes vasoconstriction and subsequently hypertension. This effect is usually short-lived and subsides as soon as the central alpha-2 effects kick in. Dose-dependent bradycardia occurs as a result of reduction of sympathetic tone, stimulation of baroreceptor reflexes, and increased vagal response. Dexmedetomidine has been found to be neuroprotective and is associated with decreased incidence, duration, and severity of postoperative delirium. Additionally, dexmedetomidine has been found to enhance postoperative cognitive function. Postoperative delirium may be triggered by the neuroendocrine and inflammatory response associated with surgery. Dexmedetomidine may inhibit this response through activation of alpha-2 adrenergic receptors and vagal nerve stimulation, preventing postoperative delirium. An exhaustive literature review substantiated the notion that dexmedetomidine could be used to reduce postoperative delirium in elderly patients. 3 randomized control trials revealed the use of dexmedetomidine intraoperatively could reduce the incidence of postoperative delirium in elderly adults undergoing surgery. In addition, low-dose dexmedetomidine could be used to decrease postoperative delirium in elderly patients admitted to the ICU after non-cardiac surgery. As long as dexmedetomidine is used within a typical dose range, which is between 0.2 to 0.7 mics per kg per hour, it has been shown to reduce postoperative delirium in elderly patients undergoing surgery. Based on the research available, the use of a dexmedetomidine infusion intraoperatively can be part of a combined general anesthetic in elderly patients 60 years or older undergoing surgery. The incidence of postoperative delirium could be measured for 3 days using the confusion assessment method, an evidence-based scale used to diagnose postoperative delirium. To summarize the main points of this educational module, postoperative delirium is an acute state of confusion commonly experienced by elderly patients following surgery. There are many adverse consequences, including increased morbidity and mortality and costs. Dexmedetomidine is an alpha-2 agonist that has been found to be neuroprotective and reduce the incidence of postoperative delirium in elderly surgical patients. Thank you so much for taking the time to participate in my educational module.